3 passengers dead, a British crew member in urgent need of medical care, and dozens of potentially exposed travelers already scattered across multiple countries, including the United States and the United Kingdom, before anyone thought to stop them. The MV Hantavirus, a luxury expedition cruise ship, has become the centerpiece of an international hantavirus crisis that is exposing staggering gaps in global health protocols and national biosecurity frameworks. The WHO has confirmed 7 suspected or confirmed cases. Argentina is scrambling to identify whether it's the source. And the ship is now heading to Spain's Canary Islands, a decision a local official has already publicly slammed. Joining me now are Elena Vasquez, our Europe and EU analyst, and Sophia Reeves, our economics and markets editor. Elena, let me start with you. Is this a genuine international health emergency, or are we watching bureaucratic paralysis dressed up as crisis management?
Thanks, Emma. And I'll be blunt, it's both. And that's precisely what makes it so alarming. What we're watching in real time is the complete breakdown of national biosecurity responsibility at every level. A ship departs Argentina, the highest hantavirus incidence country in South America, according to the WHO's own data, heads to Antarctica, records a suspicious death on April 12th, and the captain tells passengers it's probably natural causes and not infectious. Not infectious. And yet, weeks later, 3 people are dead. A British national is fighting for their life, and 40 passengers walked off at St. Helena, a British overseas territory, without, as far as we can determine, any comprehensive screening. The British government has an obligation to its citizens that supersedes anything the WHO recommends, and that obligation was not met. Douglas Murray has argued for years that Western governments have outsourced their security instincts to multilateral bodies that are constitutionally incapable of the decisive action that real crises demand. This is that argument made flesh. And I'd say the decision to redirect this vessel to the Canary Islands, rather than an isolated quarantine facility, is the single most reckless call made in this entire saga.
But Elena, the WHO is saying the general public risk remains low because hantavirus doesn't spread person to person. Isn't the severity of the institutional criticism somewhat disproportionate if this is ultimately a contained incident with, sadly, a small number of fatalities? And Sophia, what's your take on this?
Well, look, I think Elena is making valid points about institutional failure, but I completely disagree with Elena on the framing of the Canary Islands decision as the single most reckless call. The most reckless call was made weeks earlier when nobody established a clear chain of command for this vessel after the first death. Here's the economic reality that nobody's talking about. The Antarctic expedition cruise industry is a booming, largely unregulated sector. Ocean-wide Expeditions, the operator of the Hantavirus, runs premium Antarctic voyages, attracting wealthy international travelers, and the commercial incentive to downplay onboard illness to keep itineraries moving to avoid the catastrophic reputational and financial hit of declaring a health emergency is enormous. The captain's April 12th announcement framing the death as natural and non-infectious, that is not just a communication failure. That is a commercial calculation. And until we have mandatory enforceable health screening protocols for vessels departing high-incidence disease territories, this will happen again. I hear what Sophia is saying, but with respect, that misses the point entirely. Commercial incentives exist in every industry. That's why you have regulatory frameworks backed by state authority. The reason those frameworks failed here isn't the market. It's that no sovereign government along this ship's entire route had clear, unambiguous authority and will to act decisively. St. Helena is a British overseas territory. British officials were on the ground. 40 people got off that ship. Some of them are now presumably back in the United Kingdom. That is a border failure, a biosecurity failure. Full stop. You can't blame market incentives for the fact that a British territorial administration didn't have the protocols or the backbone to hold those passengers for screening. That's not a market problem. That's a governance problem.
Here's what I want to know. 40 passengers have already dispersed, some reportedly back in the United States. The incubation period for hantavirus runs up to 5 weeks, and we don't yet know definitively where this outbreak originated. If this isn't contained in the next fortnight, what does the escalation scenario actually look like? Sophia, where do you see this going?
The way I see this playing out, The most likely trajectory over the coming 2 to 3 weeks is an uncomfortable but ultimately contained resolution. No secondary transmission chains, because hantavirus simply isn't efficient at spreading person to person, and the dispersed passengers either develop symptoms and seek treatment promptly or don't develop them at all. But here's what concerns me about even the contained scenario. If this ends without major secondary cases, the institutional lesson that gets drawn is the system worked. And that is a dangerous, dangerous conclusion. The system didn't work. 3 people died, dozens scattered before screening, and a contaminated ship is sailing toward a major European tourist hub. The trajectory suggests that without a formal post-incident review with real teeth, binding protocols for Antarctic departure screening, mandatory quarantine powers for vessels in British overseas territories, we get the same outcome next time, except perhaps with a pathogen that is efficiently transmitted between humans. Here's what concerns me most, and I think this is the scenario nobody wants to say out loud. Argentina is the probable source. Argentine officials are scrambling to confirm this. If the investigation confirms that the virus originated in the embarkation region around the Argentine coast or Patagonian interior, the question of pre-departure screening becomes unavoidable. Thousands of international travelers transit through Argentine ports every year for Antarctic expeditions. That's not a small industry. And if there's no mandatory rodent exposure risk screening before boarding, no systematic health declaration process, then we are one bad outbreak away from a very different kind of crisis. The risk here isn't hantavirus specifically. It's that the architecture of Antarctic expedition tourism is operating on an assumption of safety that this outbreak has now definitively shattered.
3 dead, 2 Britons self-isolating, and the ship sailing toward Spain, and somewhere in a WHO conference room, someone is drafting a press release about how the risk to the general public remains low. Elena Vasquez, Sophia Reeves, thank you both. When the bureaucrats finally finish patting themselves on the back, perhaps they can explain to the families of 3 dead passengers exactly how well managed this was.